Today's topic is Babinski Reflex. Welcome to our channel, Internal Medicine by DZ, the online learning platform that provides medical education to healthcare professionals and students to improve their clinical skill and help them in their studies, courses, careers, and research. The Babinski reflex or plantar reflex was described by the neurologist Joseph Babinski in 1899. Since that time, it has been incorporated into the standard neurological examination. It is easy to elicit without sophisticated equipment. Also, it requires little active patient participation, so it can be performed in patients who are otherwise unable to cooperate with the neurological exam. Indications: the Babinski reflex is done as part of the routine neurological exam and is utilized to determine the integrity of the corticospinal tract. The presence of a Babinski sign suggests damage to the corticospinal tract because its fiber tracts run from the brain through the brainstem and into the spinal cord. Lesions of the central nervous system often affect the integrity of the corticospinal tract. Thus, the presence or absence of the Babinski reflex can provide very useful information on the presence or absence of pathology affecting the CNS. Babinski reflex is especially important in the setting where there is suspicion of spinal cord injury or stroke, as it may be an early indicator of the presence of these emergency conditions. Equipment: the Babinski reflex should be elicited by a dull, blunt instrument that does not cause pain or injury. Sharp objects should be avoided. The dull point of a reflex hammer, a tongue depressor, or the edge of a key is often utilized. Technique: to test for Babinski sign, the instrument is run up the lateral plantar side of the foot from the heel to the toes and across the metatarsal pads to the base of the big toe. The examiner watches for dorsiflexion, which is upward movement of the big toe and fanning of the other toes. When this occurs, then the Babinski reflex is present. The presence of this Babinski reflex is indicative of dysfunction of the corticospinal tract. If the toes deviated downward, then the reflex is absent. If there is no movement, then this is considered a neutral response, has no clinical significance.